Hi, I'm Devora and today I'm going to talk about my Venus Viva machine over here that basically has two functions, two treatments we do with it, and I'm going to talk about one of the treatments today. We have this handle, which I'm going to talk about. This does fractional treatment, and we have the second handle over here, this that does diamond, but we're not going to talk about the diamond. We love the diamond, but we're going to leave this for a different day, a different video. Here is my fractional. Now, what does fractional do? I'm going to start with just a little background about skin texture and how things work, and then we're going to get into questions. When our skin gets a scar or any type of damage, which a scar could be also a type of wrinkle, a small wrinkle, a collapse in the surface of the skin. When it falls, basically our skin is nice and stretched and it falls in. So it's a type of scar also, I could call it. Or pigmentation, which is coloration, which comes from the sunspots or some kind of scar that got pigmentation around. All those things happen in three basic levels of the skin. And what we're going to try to do with a fractional, we're going to do small little holes in the skin. And that way the skin could recover and bring in new skin and get all the good functions back to normal, back to, like, if it's like mature skin, I say like go back a few years. So it depends what your skin is going to do. It's not injecting anything from outside. It's how much your skin is going to repair itself well. So that's how much results we're going to get. So it helps with texture, open pores, texture of small line, a little bit more puff. Sometimes we lose some of the puff in the skin when we get these lines, let's say. A line over here or a line over here, it's usually because we lose a little bit of the fat over here. What kind of fat? Collagen. So when we break it down, new collagen comes in, and sometimes we could get a little bit more of a lift around this area or this area. Small lift. It's not a surgery, but it's a small lift that we could see a little bit more. So that's a few of the functions that we have with the machine. Now I'm going to go into questions that we have over here. Does the treatment last, or is it a cosmetic thing? Like, you know, people say cosmetic when they mean something that you do and then afterwards it comes back. Okay, so if we're talking about acne scars come from acne. If you get a pimple and it left a scar, either a dent or a bump, the treatment, we're going to break it down and we're going to recover the skin. Like, we'll get new skin, we'll get rid of that scar and it'll be gone for good. There's no reason it should come back unless you get a new pimple and that pimple leaves a scar. Okay, so same goes for wrinkles and little lines and open pores. Skin naturally is aging all the time. So with anti-aging treatment, I can't say it won't come back, not because the treatment doesn't last, because our skin is always aging. So usually we do a 5 treatment session or 7 treatment session. And then after that, we upkeep it once every 3 months, or we end up doing another cycle 2 years later, a year later, depends on your skin and how much it aged in your stage. Open pores, they keep opening. The pores, they widen. Oily skin has open pores. It's normal, it's good. Some people feel like their skin looks a little bit like an orange peel, like it's a little too wide. It can definitely help to close those, but that does come back because our pores naturally are widening all the time also with the aging. So that's as far as that. And we also treat some kind of redness that people have on their skin, rosacea and things like that. That also comes back because that comes from the blood vessels, and that keeps happening. You keep blushing, keeps widening the blood vessels, and then it comes back again. So as long as the cause is not coming back, then you're okay. Let's say acne. If you don't have acne and you're not scarring, you're not going to scar again. But aging and all the rest of the things that we discussed, they can come back or become again. Okay, next question. How does the treatment work? Okay, so I explained a little bit how the treatment works, but basically what we're doing, it's not needles, it's radio frequency. It's causing a little puncture, as if like a little tiny needle, but so tiny that you can't even see it, or like it's very safe as far as like if you go do, they have the treatments that they do a lot of needles to get the same results. It's not anywhere like that because the needle is very thick compared to what a small RF pin as if could do. You know, so it makes little dents, little holes inside the skin with very distances between them. Exactly the amount of distance that the skin needs, enough to break it down, and enough healthy skin in between dent to dent, in between hole to hole, to recover the hole from the bottom, to to bring in healthy skin and recover. So the way it works, we take the fractional and we go on the area like laser. We go like this, we press, and it makes a little beep, and we move on to the next area. Right now, it's not on. So I'm just doing as if. So like this, and I'm moving from place to place like that. That's more or less, we cover the whole area of the face. We could do around the eyes also. And that's how we do the treatment. Okay, next question. Does it hurt? So there is some comfort in the treatment. It depends by the person. Me, I don't care. I like the pain. I mean, I feel like it's doing something, and I'm actually getting rid of my lines and getting my skin all nice and glowy. So as far as pain, it's very individual. It's not very painful. Is it risky? So as I said also in the previous question, there is treatments that they try to do the same effect with needles. The needles, in my opinion, are very risky because you risk infections and hole being too wide and the skin not managing to recover properly. Or they do fractional also with lasers, and that's much more aggressive. And when you're too aggressive with the skin, that can cause the skin to react not in the way that we want it to react. So that's why I actually bought this machine and not a laser and not the other. I bought this specific one that has very good research that shows that it works the safest with the most results. So it's not aggressive and it's not too weak. So as far as safety, very safe. People ask sometimes about radiation. Radiation is not there's no dynamic in it, it's called, in this machine. Okay, next question. How many treatments do I have to do? It really depends on the situation of the skin and how your skin reacts. Most of the time, we say start from 5. Sometimes you could get the results after 2 treatments, but we do a memutza, 5. And if you need extra, sometimes you need 7. Some treatments, we say that you're going to need at least 10. It depends if it's a very bad scar or different situations, pigmentation that's deeper. We want to work on a lot of different levels of the skin. Every treatment, we're going to work on a different layer of the skin. So those results, they build up with time. So doing one treatment of fractional, that's also a question that I have. Should I do one treatment? You can do one treatment, but you're not going to fix any severe problem you have. If you have any scar or something that you want to fix, one treatment is not going to make it. You can do one treatment if you want your skin to look really nice for a vent or something, but that would not be the preferable way to use it. I would prefer to do just a regular facial before a vent rather than do this. This is more long-term, fixing the skin, resurfacing new skin. We need the 5 treatments. We need the 5 months. Every treatment you do once a month until you're done with the treatments. We need that time. The skin needs the time to recover, to repair. We do a before and after picture, and then you could see really the results. Now, another question I get a lot is, can I not do it every month? Or can I do it sooner, like every 2 weeks? So sooner we cannot do because we're breaking down the skin. We're causing some kind of, ptsiya mevukeret, and we need the skin to recover from that. We cannot go and do another one on top of it because that won't be good for the skin. Okay, so once it recovers, then we could do the next one, and that's a month. On the body, if we do scars on the body and things like that, 3 months we wait in between treatments. That takes a little longer. Another question, how do we book a consultation and all that? If you want to do a phone consultation, you can send in 3 pictures, one good picture of this side, middle, and the other side. But it has to be not this side, not a selfie. Someone else should take it from these cameras. They're much better and I could see the skin. You take those 3 shots and you send them in with good lighting. Make sure they're very clear. You send them in WhatsApp, and then we book a phone consultation, and then I speak to you looking at the pictures, seeing what you want. That's as far as that. If you have any more questions about it, I'll be happy to answer. Just send me a WhatsApp, and that's it. Have a great day. I'm looking forward to seeing you. Bye.